This is so incredibly difficult. I think you know, and the readers at BND know, that it was even before we put the stay-at-home order in place. Indeed, one of the very first things that we had to do to deal with COVID-19, that we had to cut off visitors to nursing homes and long-term care facilities, because it was clear early on that one of the most vulnerable populations is our elderly. And it was in nursing homes in places like Washington State where we had already seen outbreaks that were taking people's lives too quickly, without any ability really to treat them fast enough or to rehabilitate people once they've gotten sick. So this was something we were trying to prevent desperately in the state. We had to shut down visitors. We also started doing medical checks on every staff person on every shift so that we could try to prevent people from bringing COVID-19 in. That was in early March. I mean, that seems like years ago now, and I'm sure for family members too. As you know, we've continued that policy. And indeed, we've made it even more difficult for people to enter into long-term care facilities because, you know, COVID-19 doesn't live in a facility. It comes in with somebody and then it spreads. And so the 1,200 plus long-term care facilities, nursing homes across the state, we've tried to make sure that we're on top of wherever the outbreaks are and also where there are no outbreaks to keep the people out. And to make sure that we're keeping COVID-19 out. When will visiting resume? I must admit to you, the CDC is telling every state that this may be one of the last things in dealing with COVID that will happen is new visitors or visitors being able to come back into those facilities, because it is precisely from those visitors, even those who are asymptomatic, who may not think that they have COVID-19, that you get an outbreak. And so I can only tell you I'm listening to the Dr. Zika and others and the CDC when I tell you that, at least for the time being, we can't allow visitors back in.